Hi, Dr. Eric Balcavage, and we're back for another edition of Thyroid Thursday. And today I want to talk to you about hypothyroid symptoms. So many people ask me the question, how can I have hypothyroid symptoms if my doctor tells me my gland is working fine or my levels are normal? Hypothyroid symptoms aren't about your gland per se. Hypothyroid symptoms are all about how much thyroid hormone, T4 and T3, gets into the cells of the body, okay? So you're probably familiar with these symptoms: fatigue, weight gain, dry skin, constipation, all of these guys. But these guys occur not because of what's being made here, but because of how much thyroid hormone gets into the cells. So you could have a thyroid gland that's making enough T4 and T3. You could have enough T4 and T3 in the bloodstream. But if that T4 and T3 does not get into the cells of the body and bind to the thyroid hormone receptor inside the nucleus of the cell, then you're going to have hypothyroid symptoms. It's that simple. Unfortunately, most of the standard tests that docs are looking at to determine if your thyroid gland is working aren't representative of what's happening here. And this is the bigger piece of the picture, okay? So let's talk about what it's required to get T4 and T3 into the cell, and once it's in the cell, convert it into active T3, because T3 is what actually binds to the receptor to stimulate metabolism, okay? So the first thing you need is you have to have transporters that can carry T4 and T3 into the cells. Now, the transport molecules are different in the pituitary gland than the other cells of the body. Okay, the pituitary gland really requires very little energy to transport T4 and T3 into the cells, but the rest of the cells of the body require active transport. That means it requires energy. So if you're in a low energy state, you have insulin resistance, you're dieting, you're chronically stressed out, chronically tired, there's a number of things that can decrease energy and therefore decrease transport into the cells. So that's problem one. Problem two is it requires much more energy to get T4 into the cells than it does T3. So T3 can often diffuse into the cell a little bit, or not diffuse, but actively be transported into the cell at a lower energy rate than T4. T4 definitely requires more energy. So if there's anything that's any low energy state in the body, you're tired, or anything that blocks or inhibits the transport, you're not going to get sufficient T4 into the cell to be converted. And we know that the vast majority of thyroid hormone floating around is T4, not T3, so it is really important to get T4 into the cell. So that's the transporters. That isn't really measured by just looking at traditional TSH and T4 values, okay? The second thing that's really important are something called the Deiodinases. And we've identified three of these guys: D1, D2, and D3, okay? And the concentrations of D1, D2, D3 are different throughout the body, okay? The important part is that they do different actions. D1 and D2 will take T4 and convert it into T3, which is good because then T3 gets into the cell and it can bind to the thyroid receptor, metabolism works, and you feel great. T4 can also be acted on by D1 and D3. And these guys will convert T4 into reverse T3. And reverse T3 can get into the nucleus and block T3 from actually binding to the receptor. So if reverse T3 is binding or blocking that receptor, you're not going to get T3 binding, and your metabolism is going to slow and you're going to develop symptoms. You're going to develop symptoms, but T4, T3 will look great in the bloodstream, okay? The next thing is that you have T3 that actively transports in, and T3, once it's transported into the cell, can be transported right into the nucleus, and it can bind to this receptor. That's good. But T3 can also be acted on by D1 or D3 and make another inactive form of thyroid hormone called T2. And that's how we kind of recycle thyroid hormone. So if you've got lots of D2 and the only thing D2 can do is make T3, then you're probably in pretty good shape. But if cells have D1, higher concentrations of D1 and D3, and the right reactions are occurring in the body that increase the activation of D3 or decrease the activation of D1, then we're going to have more reverse T3 made. And if we have more reverse T3 or more T2 made, then metabolism is going to be slowed. Appropriate levels of T3 will not bind to the receptor, and you could have hypothyroid symptoms. There are some problems that can occur with how the receptor works, but primarily the big things that are important are that you can have a healthy thyroid gland. You can have appropriate levels of T4 and T3 in the bloodstream. But if T4 and T3 can't be actively transported into the cell, then you're going to have hypothyroid symptoms no matter what your concentrations are out here. And if you have upregulation of the enzymes, the deiodinase enzymes that make more reverse T3 or more T2, then your metabolism is going to be slowed. You're going to have hypothyroid symptoms even though the thyroid gland is working and T4 and T3 levels are normal, okay? So having appropriate T4 and T3 levels is like having a full tank of gas. But just because you have a full tank of gas doesn't mean the gas gets into the engine and it's going to make the car run. You could be without an engine. You could have no spark plugs. You could have bad spark plugs. You could have a clogged oil filter. There's lots of things that could happen inside the engine of the car to prevent the gas from getting in and making the car run. The same is true of thyroid hormone. It's not about the gland when you start having hypothyroid symptoms. Most times people have symptoms, they'll go to their doctor, they'll only get a TSH and a T4 run, and the doctor will use these two markers to determine if they have thyroid hormone activating that receptor in the cells of all their body. And that is not a good way to determine, because TSH does not represent all the cells of the body. It only represents the saturation of the pituitary gland. And the pituitary gland's transport molecules act differently than the rest of the cells of the body. And the pituitary gland only has D2. So it can only make T4 into T3. There's no competition with reverse T3 because it doesn't have the D3 enzyme that primarily converts T4 into reverse T3. So when a doctor uses TSH to determine whether your thyroid physiology is working, he's really looking at the pituitary gland, and it may represent dysfunction of the thyroid gland, but it doesn't necessarily represent what's happening in the peripheral cells of the body. T4 could look normal because of the reasons I just explained. T4 could look normal in the blood because there's a problem with its transport into the cell. T4 requires a lot of energy to be transported into the cell. So if T4 is normal, free T4 is normal, that doesn't mean there's optimal levels of T3 inside the cell, because decreased energy levels, insulin resistance, dieting, all these things can cause decreased transport in, and we have to take into consideration that a lot of the things that block transport also create problems with these deiodinase enzymes, and instead of making T3, we're making more reverse T3 or T2, neither of which actually stimulates metabolism, and that's how you could have hypothyroid symptoms and have normal glandular function and normal levels of T4 and T3, even free T4 and T3, okay? So hopefully that helps. Look forward to another Thyroid Thursday next week.